So carpal tunnel is a very common disorder of the hand and wrist, which really usually affects the thumb, the index finger, and the long finger, but can affect all the fingers. One of the hallmarks is that it wakes people up at night, the numbness and the pain in their wrist. It could also bother them while they're driving. They have to change their grip on the steering wheel. And there's a couple of non-operative treatments, which would be splinting. Sometimes they'll get a cortisone injection. Sometimes you can take anti-inflammatories. None of the non-operative treatments are super effective at treating this. Traditional carpal tunnel surgery involves a long incision on the palm, quite frankly very painful, and can take a fair amount of time to recover from. And so I developed the Tunnel Tome carpal tunnel release for several reasons. One is to reduce the size of the incision so that the patients had a quicker recovery, and also reduce the need for any stitches. Through our experience over the years, we found patients very frustrated with the fact that they would have to go to a surgery center or hospital to get such a minor procedure done. And so here at the office, we can give the patient a minimal cost for the procedure. Some of the patients generally do them on Friday afternoons or Friday mornings, and they can go back to work on Monday. And these are people who are laborers and people who have relatively heavy jobs. Anybody who has a relatively simple desk type job can go back to that immediately after the procedure. Because we don't use sedation, the patients don't have to drive themselves back and forth. For the whole procedure, we can usually get the procedure done for under $1,000 in the office. If they went to a hospital or surgery center, it might cost them around $3,000. People barely feel anything when we do the procedure because we use a technique that involves using a vibration device and freeze spray in order to minimize the pinch from the initial injection. There is absolutely no more pain throughout the procedure. The procedure takes about 10 minutes. It's all done under ultrasound guidance, and so I can actually see the nerve, I can see the blood vessels, I can see the tendons, and therefore I can slide an instrument in and actually see that the instrument is positioned correctly away from the nerve and the tendons and the blood vessels, and then we slide a knife blade in the instrument to divide the transverse carpal ligament through just a tiny incision. We have a nice big comfortable lazy boy chair that they lay in when they have the procedure done, and we've had patients that fall asleep in the chair while we're actually doing the procedure. Well, there are no stitches to take out, and so once we do the procedure, we put a stitch underneath the skin, but it dissolves underneath the skin, and we use some little tapes. And so you don't need to come back for another visit to get your stitches out. This is it's a night and day kind of experience, and that's the way we want it. I mean, we want it to be the best carpal tunnel experience that a patient can have. That's period. That's what we're all about.